Hello everyone, welcome. Thank you for joining me. In this session, we're going to focus on a massage technique for your inner elbow. I'm going to just demonstrate on one, but you can always, what you do on one, you should do on the other. That's what I recommend. So if you have any sort of discomfort in your elbow, realize you are one connected being. So your head's connected to your neck, connected to your shoulder, connected to your arm. So all movements are going to affect every other part of your body. And that's something I want to help disseminate first, right? So even though the pain you feel is here does not mean that your neck does not affect your elbow, right? In fact, they are connected. So moving things that may look counterintuitive, like moving your neck to help your elbow up, may seem odd, but they're actually very helpful, right? Moving your spine while you move your elbow is really helpful as well, right? So I'm just gonna have my palm facing up. I'm gonna address the part of your elbow that touches itself when you bend the elbow, right? That's the part we're gonna focus on. First off, I'm gonna take my fingers to that part and just start pressing on it, right? I'm looking for places that feel somewhat tender to touch. And I'm only going to press as far as I have no pain that I can tolerate. If you have a fight or flight response, which means you touch it, it's like a hot griddle, don't press so hard there, but just acknowledge, oh, there's some real sensitivities there. And that's totally fine to have, we all go through things. Now, while you're doing this, you can try and just moving your fingers, right? And see if that helps anything become a bit more soft, right? A little less painful perhaps, right? Just try moving your fingers. There's no one right or wrong way, right? And then keep going with the one hand and try and move the other fingers, palm, and wrist. You can also rotate the forearm as well, right? And again, just feeling what feels tender, what feels sensitive here. Just probing. I'm going above and below the elbow joint, right? Here on both sides of it. Easy breathe. There's no right or wrong. Sitting up nice and tall. I recommend you sit comfortably for you, right? Now I'm going to also try and rotate the arm bone in and out. So that's the upper arm bone with the forearm, with the hand, with the palm. Easy breathe. Again, just exploring. We're in the exploratory phase of saying what feels really tender here. And for me, what shockingly feels tender is this part of my forearm, right? It's on the opposite side of where my pain is. It's really tender. It's really hot. When I push on it, I get a sense of, oh, wow, that's really sensitive. And I wasn't aware of that. That's all we're trying to do here, right? Bring acknowledgement to ourselves of what feels tender and think about, should my body be like that? Should you not be able to put external pressure softly to any part of your body, generally, unless for most people, that's a good question to think about. We're all different. We all have different needs, and some parts of our body are going to be tighter than others for different reasons. But for me, this is unusual, right? I'm not usually tight like this right on my forearm. So it's very, very informative and helpful for me. So when I am massaging, I can realize, oh, I can put a little bit more awareness to this part of my forearm that is not where the pain I feel is, but it's really tender there. That's going to help, right? The next thing you do while doing all this is moving your head side to side as far as you have comfort, right? With rotating the arm bone, rotating the wrist, make the fingers move, right? That's not right or wrong. And again, we're just exploring. The one hand's moving all around. Easy breathe. That's right. You can also try twisting your head side to side as well as you do all these movements, right? Really good job. You can also try bringing your head down and up to one side and or the other. Easy. I know it looks odd and it might be like, well, we're trying to address our elbow. Why all these movements? Because you are all connected. Every part of your body is connected to everything else. You are a closed system like an amoeba. So it's helpful to move different parts, especially when you're doing an exploratory thing like we are now, to try and feel what is tender, what is affected, right? And as I move, I can really feel that for me, this part of my elbow that's between my elbow and the wrist, closer to the elbow, is really soft and tender. That's very fascinating because it's not usually like that, right? Now, I'm going to go on the inner part of the arm above the elbow, so towards my shoulder. So I put my arm, palm facing up, the inner side that's closest to my torso. I'm going to do the same thing there with my fingers, just exploring. Excuse me while I look at the clock, see what time it is. See what feels good there, right? Easy. You can try pinching as well with your thumb on one side, fingers on the other. And again, try moving your fingers. Easy breathe. Move the palm and wrist and forearm. Good. You can try rotating the arm in and out. You can also try, I forgot to mention, you can try bending the elbow a little bit one way or the other. That's hard to bend the elbow and massage at the same time, so I didn't talk about the elbow, but when you're above the elbow here on the upper part of the arm bone, you can also try bending it. Also try moving your head side to side. You can try twisting side to side, easy. You can try looking up and down, rotating side to side, and just feel how that is affecting what you're feeling in your upper arm bone here. And I am not feeling personally anywhere near the level of sensation that I did between my elbow and wrist, right? So from my elbow to above, there's not anywhere near the same level of intense feelings as I had below my elbow, between my elbow and my wrist, and that's really interesting. It's a little tender, more than usual, I would say, but not like it is below. And that is really, really helpful, right? This next thing I'm going to do, I'm going to take my knuckles, I'm going to stretch the arm wide, I'm going to pull the fingers back. I'm just going to press my knuckles down along the inner groove of my elbow towards my wrist, because that's where my most sensitive parts are, right? I can start above the elbow, scrape through the elbow, and draw it down. Easy, just keeping the palm pressing out, just going all around the elbow, right? From above the elbow on the shoulder side to down below the elbow to the wrist side, right? Going all the way around as much as I can. Easy breathe. As I go to the other side of the elbow, I'm going to bring the fingers down, right? Because that elongates that side, the fibers on that side of the arm, right? And again, it is really helpful to do self-massage, especially when you have pain or stiffness that's new, right? And to know what's new, you kind of have to have a little massage practice going in the first place, so it takes some practice to acknowledge how your body feels in different ways. But once you have a baseline reading, like for me, I know my forearm doesn't usually feel like this when I touch it. That means I have experience in the past trying to massage my lower arm here, and I know that I don't typically have this sensation that I feel today when I do that self-massage in the past. So something is different, something's new, right? And this is just really helping me acknowledge that I need to create as much awareness, but also just gentle massage. Getting the benefits of a massage through my elbow and forearm is really, really, really quite helpful. And then rest, right? And that feels much different than before. It's not now quite a stiff feeling. I'm not saying it cured it, but it does feel like I just have a lot more freedom of motion without sort of stiffness or feelings of tenderness in movement. And that's a really great thing to do. Right, so just take that practice to you. After effects might be, you might see a slight discoloration turning towards pink reddish, or whatever color you turn when you have massage or circulation in your body. Everyone responds to that differently. You may have an itchy feeling on the arm that just can generally mean it's just circulation through tissues that weren't getting enough circulation before, right? You might have a soft, subtle swelling. It might be a little bit tender to touch for a little bit, right? But there shouldn't be any dramatic increase in pain or lack of movement. If you have an increase in pain or lack of movement, you know, you've gone too far, too soon, too quick, too deep. Any kind of bruising, too far, too soon, too quick, too intense, too sudden, right? Back off of it. Of course, I recommend you always go to the doctor, any professional, if you have any kind of joint pain specifically. This is not what this is for. I'm just saying I feel a little bit stiff and rigid through my elbow today. I don't usually, and that's one way I look at addressing that for myself. If that pain continues or increases, I would go see a professional. I hope you enjoyed. My name is Eric. This is Nucleus Strength. I look forward to getting stronger with you in the future. Yours in good health. Take care.